Hey there, I'm Sarah McLaughlin. Thanks for joining me on the Chaos to Calm podcast, a podcast designed for women over 40 who think that changing hormones might be messing with their mood, metabolism, and energy, and want to change that in a healthy, sustainable, and permanent way. Each episode will explore topics related to health and wellness for women in their 40s, like what the heck is happening to your hormones, what to do about it with nutrition, lifestyle, and stress management, and inspiring conversations with guests sharing their insights and tips on how to live your best life in your 40s and beyond. So if you're feeling like you're in the midst of a hormonal storm and don't want perimenopause to be horrific, then join me on Chaos to Calm as I share with you how to make it to menopause without it wrecking your relationships and life. Hello and welcome to episode number 27 of Chaos to Calm podcast. I'm your host, Sarah McLaughlin, the perimenopause naturopath. And today I'm super excited to be welcoming Chandrika Gibson to the show. And Dr. Chandrika Gibson has been a naturopath since 2000, became a yoga teacher and yogi therapist in 2005, and has worked extensively with people diagnosed with cancer since 2006 in her private practice, Soraya Health. And she has done a Master's of Wellness, and she also has a PhD, and her research investigated the psychosocial education and support needs of people diagnosed with head and neck cancer and the health professionals who care for them. So her research findings covered off the health professionals' compassion, fatigue, and burnout, body image distress for the cancer sufferers, and the communication in health settings. And it's been published widely in peer-reviewed journals. And she is such an expert in this area. I'm so excited to have her on today. We're going to be talking about sudden medically induced menopause and why HRT may not be the right decision for you in those situations, particularly for breast cancer survivors. And we're going to talk some about the things that are proven, food as medicine and lifestyle changes that can help you. So without further ado, let's dive in and welcome Dr. Chandrika Gibson with us today. So thank you for joining us today, Chandrika. It's really exciting to have you here and be talking more about how younger women might find themselves suddenly in menopause and how that might feel, and things that they can do if HRT is off the table with them. So perhaps we might just start today with getting to know you and how you found yourself. You know, you've got a PhD, a Master's of Wellness. You've got like so much experience and knowledge there. How did you come to be where you are today?
Well, thanks for having me on your podcast, Sarah. I love the name of your podcast, Chaos to Calm. It's really, it really evokes what we hope we can do for people when they're experiencing any kind of health issue. And yeah, so my background, my story is, I started out pretty passionate as a young naturopath. And when my dad was dying with lung cancer, I tried to throw all my naturopathic knowledge his way. And I quickly learnt that in the space of cancer, there's a lot of things that we might think as naturopaths are logical and sensible, but that don't necessarily interact really well with conventional treatment. And so that kind of started me on this long and winding road of the last 30 years to try to understand how can we really practice integrative oncology. And that journey has led me, yes, through higher degrees, including a PhD. And so I'm trying to use the term doctor now more, Dr. Chandrika Gibson, but I don't want to ever pretend that I am a medical professional, because I'm not. In fact, I'm much more interested in the psychosocial, in the mind body, in the things we can do from a natural health perspective that don't interfere with conventional treatment. And that has brought me to this space of working with people with breast cancer. So I am employed by a charity, by Breast Cancer Care WA. They are the most fantastic, holistic organisation I've ever worked for, and I've worked for a lot of places. They have a team of breast care nurses who are specialised in oncology care, including one who specialised in metastatic breast cancer. So that's advanced breast cancer, or I know the patients or the clients themselves wouldn't like to term it this way, but that is life-limiting breast cancer.
Mm-hmm.
And they also have a team of counsellors who are working in that more psycho-oncology space. And so I kind of work across both sides of the team, and I work to give them up-to-date research information, but also really pursuing my passion of trying to work more closely with all of the health professionals that surround people when they have a cancer diagnosis.
Mm. And that's what your PhD was about, wasn't it? It was delving into those psychosocial parameters and how the carers and the patients were traveling through that whole experience of cancer treatment.
Yeah, that's right. So that was focused, my PhD was focused on education and support in head and neck cancer. And, it's not so dissimilar, although head and neck cancer is less common. And obviously,
Mm,
when we're thinking about perimenopause and menopause, that's going to be more relevant to most people with breast cancer who are,
mm,
largely women, although there are some men, and obviously non-binary people and trans people can have breast cancers as well. So,
mm,
yes, the menopause story is more specific to the breast cancer population, but I found that a lot of the issues are across both cohorts because, head and neck cancer visibly changes your appearance because your face and
mm,
your neck and your throat and your mouth are treated. And so that is something that I wrote about, was the body image
mm,
distress that can occur. And it's the same in breast cancer. And a lot of
mm.
people think, well, yes, of course, if you have to have a lumpectomy or a mastectomy, and particularly a radical mastectomy, that changes your appearance. You lose your breasts. Some people have them reconstructed. Some people
Mm,
choose to stay flat. But there's also other elements to appearance change, and some of that is what looks like very rapid aging, and that's the
yeah.
medically induced menopause. For
Mm,
most of us, if we're mostly well, it changes gradually. We notice our
yes.
cycles change, we notice those, night sweats and hot flashes and all of those symptoms, but they're quite gradual for most people.
Yeah.
Whereas when you have medically induced menopause, then it's extremely sudden and it can happen at a much younger age than would typically be expected as well, which means your peers aren't necessarily going through it at the same time, which makes it more difficult to seek support. You don't necessarily feel as well understood by the people around you.
Yeah. And I think part of that too is that we tend to, or our society tends to associate menopause as being an old woman. And the reality is, like, you could start perimenopause in your mid-30s, or you may be thrust into that menopause with for those medical reasons you just mentioned. So we kind of have to unravel that aspect, and that the two aren't related. Or
Yeah.
yeah, then they're not mutually exclusive, or not trying. I'm not getting it out very well today, but I think that's part of the problem, is that we tend to think, oh, well, that's what happens to Nana and Grandma, not that I could be in my 40s. I am in my 40s and I am menopausal, but most of my peers are not. And
Oh,
yeah, it can be really lonely for people if you don't have, maybe mum never talked to you about it. I know my mum didn't, her mum didn't talk to her about it. Can be
yeah,
quite
it's one
lonely.
of
That,
those taboos, isn't it? And in the
yeah.
workplace, it can be quite taboo. And
Yeah,
yet,
I think there's a sense of shame around it. Would you agree? Like, or maybe shame's not quite the right word, but we feel embarrassed, maybe. That,
yeah.
yeah,
I mean, I
I'm
think
not.
there's a real renaissance happening. I think that the next
Mm,
generations of younger people having
definitely.
their menstrual cycle celebrated is really beautiful.
Yes.
And I see much more kind of what we know as naturopathic practitioners, this kind of attunement with your cycle and understanding the phases of it. That is becoming
Mm,
much more in the mainstream and in the kind of zeitgeist. But I still
yes.
think there is taboo, and especially, I notice myself, I'm still having a menstrual cycle and I'll tuck a tampon or a cup up my sleeve. I won't necessarily be
Yes.
obvious about it.
Mm,
And, I
mm-hmm.
work mostly with women. There's nothing to hide. There's no shame. And even if I was surrounded by men, there's no shame. But
That's right.
there is this sort of sneaky, like, oh, it's private, it's a bit, I don't know, maybe
Even a bit
we've
dirty
yeah, we've
and
absorbed some
yeah.
of that kind of cultural weirdness around it's unhygienic, even though obviously it's not.
Exactly. It's
Yeah.
actually, yeah, a very clean process. I think that is part, I remember like as a teen, just inheriting that kind of, I think perhaps the shame is around that it's, dirty or unclean um, and that kind of continues, doesn't it? But all these conversations that we're having, like, us here today, but also in the wider community, I've noticed much more conversation around perimenopause and menopause. And so, yeah, I agree. The next generation, they're going to start reaping the benefits of that. But even us and women in their late 30s and 40s will have a totally different experience to, say, when I started perimenopause 8 years
Oh,
ago or so. Yeah, I think so. But still, if you're not in that space or you're not feeling like, oh, okay, maybe perimenopause is happening for me and this is what's going on, if you're thrust suddenly into getting a diagnosis around breast cancer and then these things happening, like, it's a lot to process. It's quite shocking
it
in a
really is
small
a
amount of
lot.
time.
Yeah, and I
Yeah.
think, this is partly why I'm so interested in the psychosocial aspects, because everything to do with the disease gets a lot of airtime. Every health professional wants to talk to these patients or clients about
Mm,
the disease and about the conventional treatments, but they don't necessarily want to hear about the impact on the rest of their life. And the menopausal
mm,
impacts are pretty intense and have a wide ranging effect on people's lives. So it
mm,
affects around about 16,000, mostly women with breast cancer, but also with ovarian cancer and uterine
mm,
cancers in
mm-hmm,
Australia. The reason why they can't take HRT to kind of remedy their menopausal symptoms is
mm,
because up to 80% of those cancers, well, between 60 and 80% actually, there's different cell biology, but
mm,
quite a large percentage of cancers are driven by hormones, meaning they're hormone receptor positive. So if you have circulating estrogen, progesterone, and Herceptin, these can feed tumor cells. And so the concern is if you've had a breast cancer, you need to block those receptors
mm,
so that you don't have circulating hormones that can feed cancer cells. And so it happens really suddenly. It happens either
mm,
through surgical removal of the ovaries and or combined with chemotherapy, radiation, and then these
mm.
hormone blocking drugs, which are a relatively long-term treatment. You might have heard of tamoxifen. There's also
Yeah.
other drugs that are in the aromatase inhibitors class, and they greatly reduce the risk of cancer recurrence or progression.
Mm,
So it is important that people who've
yeah.
had a diagnosis of a hormone receptor positive cancer do take those hormone blocking drugs. But a lot
Mm,
of people can't maintain compliance, don't want to take them long term because the
yeah.
side effects are so intense.
That's right. And like perimenopause, it's there for a reason. Like I say to my kids, this is, a different kind of analogy, but that one of them, my youngest, was saying she was worried about getting older and becoming an adult. And, or people say to me, oh, how do you have 4 kids? And I say, well, I didn't have them all at once. And they weren't, I got one at a time, and we started with a baby, and now I have a 19-year-old as my eldest. So it's always progressive and a bit gentler. You get used to the idea. And the same with perimenopause. We get
Oh,
time to get used to the idea, don't we? But there's just so many things going on for these women. And, like when you might have your scan or your biopsy, you might get a phone call, like really quickly and be booked in for treatment or surgery within a week.
oh,
So it's not a very long time to get your head around what's happening. And then your body is just totally thrust into a hormone absent space, which is
yeah,
different to the 10 years that your body might have had to get used to it in a regular perimenopause experience for people. So
yeah.
you told me a really interesting stat when we were talking last time as well about, because also perimenopause, breast cancer, when I was younger, it was a more mature woman, say in their 50s or so, they were more likely to have breast cancer. But you were telling me some interesting stats around actually how young women are getting diagnosed.
Yeah, I mean, all cancer risk increases the older we get, But yes, breast cancer particularly can happen quite young. About a quarter of diagnoses are in people under 50 years of
Mm,
age. And so the new messaging is, check your breasts at 40, from 40 on.
mm,
And yet we see, at Breast Cancer Care WA, we have our support groups are segregated in terms of age. We have young women's support groups because we have so many people under 45, people dealing with young children, school-age children, careers that were, just hitting their stride really
mm.
when they were diagnosed. And so their issues are quite different from the older cohort of people with breast cancer who also go through, a huge rigmarole, and it's a
Mm,
big deal.
mm,
But yeah, that's a lot of people actually. Almost 25% of diagnoses are under 50.
yeah. Do you know if it's always been that way, or is this a newer trend, or there isn't the data to make that?
There is the data, actually. The cancer registries are pretty amazing.
Yeah.
If you ever want to look up those stats, listeners, you can
Yeah.
hop on the Australian Institute of Health and Wellbeing or Welfare, the
Hmm.
AIHW site anyway,
Yeah.
and they have all of the cancer stats. You can break them down by age, you can break them down by tumour stream, type of cancer,
Wow.
and state.
Yep.
And so it's really well recorded data. And so, yes, breast cancer is being detected earlier. And so the question
Mm.
is, does that mean it was always happening earlier and we just didn't pick it up till later?
Yep.
That's entirely possible because our public health messaging is better and people
Hmm.
are, in general, more health literate, maybe
Hmm.
thanks to the internet. And so they're getting screened sooner. They're more inclined, if they find their own lump, to go and get it checked out, or if their GP does other health checks, to notice some kind of irregularity that causes people to get a diagnosis sooner.
Hmm.
And that is a good thing, although there's a bit of nuance there, because there is a sense that there might be some kind of over-treatment of some particular types, like the non-invasive breast cancers that are
Mm.
called ductal carcinoma in situ.
Hmm.
They're just in the milk ducts and they haven't spread into other tissues. And this still gets classed as breast cancer. It still gets treated with surgery and radiation, not necessarily chemotherapy. In fact, that's kind of off the table usually with DCIS.
Hmm.
However, there is a kind of sense that perhaps this is too medicalised for something that is not likely to spread and not likely to be life-threatening.
Mm.
But it doesn't matter. For the person who gets the diagnosis, it doesn't make that much difference. They still get the whole experience of, oh
Mm.
my goodness, this is a cancer diagnosis.
Mm.
My life is potentially under threat, even though the survival rates are fantastic. We're
Yep.
up to, I think we're close to 98% of people with a breast cancer diagnosis are still alive 5 years post-diagnosis to tell the tale. So that
Wow.
is a massive amount of
Yeah.
survivors.
Yep.
But in those survivors, those people, a lot of them who've had these hormone receptor positive types of breast cancer,
Mm.
are then on hormone blocking drugs for 5 to 10 years. Recent research indicates that it might be safe to stop sooner,
Mm.
but the reason that I explained before is that it lowers the risk of recurrence, or
Mm.
if you've got metastatic disease, it lowers the risk of progression or
Yep.
slows progression.
Mm.
And it also has some other benefits. So because obviously you don't have your circulating hormones that would normally protect your bone mineral density, then the tamoxifen actually protects your bone mineral density.
Yeah.
The other
Okay.
class of drugs decreases your bone mineral density, the aromatase inhibitors.
Yeah.
So that's problematic because then you've got your osteopenia, your
Yeah.
osteoporosis, your risk of bone fractures, etc., goes up.
Yep.
So like you said before, it's kind of like very rapid aging. You're
Mm.
dealing with, the bones of a much older person if you're on those aromatase inhibitors. But yeah, so taking tamoxifen is important. It's a good thing to do. And so I think to be integrative, we have to look at those strengths of,
Mm.
what the conventional system does well. It does
Yes.
really well at keeping people alive.
Yeah.
It does really well at preventing risk of recurrence in that fairly kind of crude mechanistic way.
Mm.
But then what we can bring to it from a naturopathic and a complementary therapies kind of perspective is to help alleviate some of those symptoms, to
Mm.
use our remedies and our therapies and our presence as well. I think, being compassionate listeners is powerful medicine.
Yes, absolutely. Yeah. I was just going to say, I think that's something that we do really well is teaching people how to eat what food can do for them, and also focusing on those lifestyle, that holistic view, and really caring for yourself. And I feel like that is something that a lot of people are not used to doing, or not as connected with them, with their food, but also with themselves and what their body needs. And I know that's I've always been passionate about it. That's why I started studying naturopathy, was I just wanted to teach people how to eat and how to put their plate together and look after themselves. But I think that's what we're really good at doing. Would you agree with that?
Yeah, I definitely think so. And I think that, I know some people don't like the term coach, and that health coaches might
Oh,
encroach on our turf a little bit, but I think we do a really good job as kind of motivational interviewers, coaching people to do
yep.
what most people do know what a healthy diet looks like. But then when we get into the cancer space, oh my goodness, people are just bombarded with really non-evidence-based information that's very conflicting and very confusing, and they get tied up in knots about, thinking kind of magical thinking, like if I can get my diet perfect, if I have
Yes,
this clean diet, if I live the perfect lifestyle, if I
exactly.
don't ever get stressed,
Yeah.
then my cancer won't come back. And
I
we know that that's not possible.
I know, and I can totally understand and empathize why they'd be feeling that way. But it falls into my observation there is that all or nothing. That we have that grown up being thinking of that diet mindset and seeing all the women around us, and diets at different times. They're either on it or they're not, and it falls into that for us as well, doesn't it? When it's with things like that, I notice for many people that they, even with weight loss and the things that I do, it's so confusing. The internet is fantastic, except it's information overload. And how do you even know what actually is going to work for you or not? And that's, again, where that evidence-based food as medicine is really valuable, but it's less hit and miss than if you're guided by someone who knows and who does
That's right.
research. So perhaps
Yeah.
you can talk us through, because there's a lot of myths and
Mm.
things like soy comes to mind. I imagine
Mhm.
how many times you get asked about it.
Oh, yes.
So do you want to talk us through some of the things that, because if we know HRT is off the table for a lot of breast cancer survivors, what things that they can do that is evidence-based to support themselves and try and help their body adjust to that withdrawal of estrogen?
Yeah. So nutritionally, it sounds boring, but a varied diet is really important.
Yes.
Not starving yourself
Oh,
is
yes.
very important.
Mm-hmm.
So people often think, if I can starve the cancer, then
Oh,
it'll
of
either,
course.
respond better to treatment, or,
Oh,
I'll survive. And they put
yes.
themselves on incredibly extreme restricted diets.
Oh,
However, that's really the opposite of what you need.
yes.
You
Mm.
need some strength, some resilience. You want to have adequate amounts of protein so that your immune system functions, so that you can
Mm.
heal post-surgery. So adequate amounts of protein, mostly from either lean meats or plant-based proteins. And basically, it's like a varied Mediterranean diet.
Yep.
You want to have lots of leafy vegetables. Things like your cruciferous vegetables are known to move excess hormones out of the system. So
Mm-hmm.
the sulforaphane in cabbage and broccoli and cauliflower, that's a really helpful thing to do.
Mm-hmm.
You can also think about, feeding your gut microbiome with all of those starchy vegetables, your root vegetables, carrots and beetroots, and again, lots of fiber, lots of variety.
Mm.
Keeping some good fats. You don't want to go super duper low fat,
Mm.
although, low saturated fat is probably a good idea, because one of the other side effects of treatment is cardiotoxicity. So you do
Mm.
want to think about cardiovascular well-being. And that's where the kind of olive oil and nuts and seeds and avocado kind of focus in a Mediterranean eating style
Yes.
has its place.
Yep.
So, not lots of red meat, not lots of trans fats. In fact, try to avoid trans fats. If you're going to be
Mm.
extreme in anything, that's the one I'd say. Be
Yes,
extreme in
that's
avoiding
okay to
trans.
be extreme in.
Yeah,
Avoid that. And I always say it's always okay to be extreme in things like avoiding canola oil or things like that, and those really crappy
yeah, that's
vegetable
right.
oils. You just mentioned cardiotoxicity. Now, some people might not know what that is. Can you tell us a bit more about that?
I sure can. So, if you have a left-sided breast cancer and you go in for radiation therapy, which is one of the, very commonly experienced treatments, the way that radiation is dosed is a small dose every day for 5, 6, 7 weeks, and people have different regimes, but it's a long-term treatment, and well, relatively long-term. And so if your breast cancer is left-sided, what used to happen is the radiation beams would go through the left side breast and hit the heart and damage the heart muscle and never recover from that. But in recent years, there's been advances in a technique called deep inspirational breath holding. And so now women going in for treatment on left-sided breast cancer, they get a snorkel and they get some instruction from the radiation therapists in how to hold their breath. They also get a little button to press. So they take a deep breath in, and when you do that, you can feel it yourself. Your chest moves away from your chest wall, moves away from your rib cage, and now the breast can be radiated without the radiation beams hitting the heart. So just by holding your breath in, you can protect your heart. But then you have to push the buzzer when you need to take a breath. And so they stop giving you the radiation so you can take another breath, and then you take another deep in breath and hold it in.
Wow,
so
how cool
protecting
is
the
that?
heart is, it's very cool, and very, to me, very yogic, very natural. Like,
yes,
let's learn to manage our breath, and that helps manage, your anxiety in the radiation bunker as well, because it's not a very pleasant environment. So that's one aspect of what can damage the heart. And because we know that survival rates are so great, it's not like, you get a damaged heart, but you're going to die in a couple of years anyway. This is like something that you might happen to you in your 30s, 40s, 50s, and you want to live another good 20, 30, 40 years. So,
yeah, that's right.
So we need to protect the heart. Chemotherapy can also damage the heart. Chemotherapy has, systemic effects. It is toxic, and I understand, sometimes in naturopathic world, people say stay away from it. However, you always have to do your risk versus benefit kind of analysis. And in most cases, it's a really good thing to do. Perhaps not at the end of life. If your time is limited and you want quality over quantity, that's absolutely a reasonable choice. But if you have a treatable breast cancer, you really should say yes to the radiation therapy and the chemotherapy, because they are proven to save your life and give you a long time to get your health back on track.
Yeah.
So managing your heart health through your diet and through your exercise and through your stress management, that's what you can do to kind of counter those not so great effects, the side effects of the chemo and the radiation therapy.
And it's interesting because I often hear, and from the few people I've known that go through cancer treatment, often they will lose their appetite or find it hard to keep down. Is that similar with breast cancer treatment? Do you know? Do they find that impact? Yeah. Okay.
Yeah, definitely. I mean, chemotherapy, it strips the mucous membranes of your mouth. Your whole gut is affected. Nausea, your liver's processing all kinds of stuff.
Yeah.
Yeah, it's really normal to feel queasy. Some people actually vomit. A lot of people don't actually vomit, but they do feel like food doesn't taste the same. And so that's another reason why I think naturopaths need to be really careful about not being so prescriptive about you must eat only these foods and blah, 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 because during active treatment, it's actually, the statistics show the best outcomes come from maintaining your weight.
Yes.
So you don't want to lose dramatic amounts of weight during treatment, even if you started out a bit overweight, and that obviously does increase your risk for many types of cancer. Once you're in active treatment, the best outcomes come from staying the same weight, which means you need to eat whatever you can tolerate, whatever you can stomach. And sometimes, things like smoothies can be nice because, they're easier to get down. You don't have to chew if your mouth is really sore. But yeah, not avoiding things, because really you actually do need calories. And again, we have this different mindset. Like in the conventional system, if someone can't eat, they might be given a sustagen or an ensure. And if we look at the list of ingredients as naturopaths, we go, oh my goodness, that is terrible. Don't do that to your health. But from a kind of biomechanical medicine perspective, that's got the ingredients that's going to keep someone alive. But we can do it better.
I was going to say, can't we replicate that with some soups and or smoothies and things like that for
Absolutely.
Yeah,
Yeah.
yeah.
And where you have clients that are, willing to make a little bit more effort, you absolutely can. So you can use things like pea protein, you can use soy milk and nut milks and make beautiful fruit and vegetable based smoothies, and
Mm,
definitely your soups, your kind of watery lentil soup to give you lots of
yeah,
protein, and things that are iron rich as well. So getting all of your, green leafy vegetables in.
yeah.
And let me speak to the soy thing. I know that we're going to be cutting our time.
Yeah, I was really curious. I was actually just thinking with the foods, I was like, if you know someone going through treatment, the best thing you could do for them is be there as a friend, but also take them some delicious, really nourishing soups, smoothies, or try and support them in that way, because I imagine they probably may not have the focus or energy for thinking about cooking, shopping, all that sort of stuff as well. But yes,
Mhm.
let's dive into soy, because I'm super interested. I want to know, like, soy and also those, because you mentioned lentils and they are phytoestrogenic from my
Yes.
perspective. So hit me with it.
All right. Well, it used to be a controversial take, but it's really not controversial. And if you want the references, I can give you all the
Well, that's a
citations
bit
because
dull. It's not controversial, but yeah, that's good. That's good, because I think it has lots of benefits. I generally tell women in perimenopause and menopause it's a lovely beneficial food to include, with
yes, it
caveats, I
is.
will say. But yeah,
Yes, with
please go on.
caveats about
Mm.
how processed it is and all of that.
Yes,
But
yes, of course.
phytoestrogens are your friend. They will not cause cancer cells to grow in the way that full strength estrogen will, because they're so incredibly weak, for
Mm,
one thing.
mm.
They're very, very weak, tiny doses of estrogens, or estrogen-like molecules.
Yes.
They're not even
Yeah.
the same as our estrogen. But also because they kind of fit the same receptors, that is going to stop your uptake from any circulating estrogen. So some things that can happen, like if you do have excess weight, is that your fat tissue can generate its own form of estrogen, and so that can be problematic. Your phytoestrogens will fill those estrogen receptors and prevent that naturally occurring estrogen from causing any growth of cancer cells. So they're really good foods to protect you from the adverse effects of estrogen, but
Mm,
also because they fill the receptors, they do to some extent moderate some of those menopausal symptoms. So it's perfect medicine. It's a tonic. It's exactly what we as
mm,
naturopaths love to do, is to give something that's not dramatically raising or lowering a level,
mm.
but actually gives the body a tonic that helps you find homeostasis for yourself.
It's so good. I love food as medicine. It's just so powerful when we know, what works for us in our current situation. So I guess that's another caveat there as well, is please do work with someone who's experienced in the cancer that you're going through or the treatment that you're having, and how to support you with that, with the right foods for you and your situation or scenario.
Yeah, yeah.
Yeah, that's so informative. Thank you, Chandrika. And I've really enjoyed our conversation today. I think we could probably keep talking for a long time.
I've got a
But
list here of CBT, mindfulness-based CBT,
yes, we have to come back
exercise,
another time,
acupuncture.
perhaps. And oh, that's right, all the lifestyle things we didn't get to go through there as well. And there is so many, isn't there, that are researched or have that research behind them. It's awesome that
Yeah, there's
we're.
a lot that people can do. So, in terms of empowering people, don't be scared of cancer,
Mm.
but instead of thinking, I'm going to treat the cancer, think, no, I'm going to support the person to be as well as they possibly can, and let oncologists do the treatment of the cancer.
Yeah, I think that's the greatest advice, is to think about supporting and nourishing your body and your mind through this significant life event. And whether that's you going through the cancer or someone going through that, thinking always that, yeah, about supporting and nourishing and holding that space for them to work their way and adjust.
Yeah, and post-traumatic growth and thriving is entirely possible. So,
Yes.
yes, we can help. That's an important role we play.
Yeah, absolutely. And yeah, I think it's always good to think about what you can do, as well as, in this, when you're taking medications or you're having treatment, you need to think about what you can't do as well, of course. But thinking about what we can do to help look after ourselves, or to teach people how to look after themselves so that they can do that in the long term.
Yeah.
I think that's really valuable. So thank you again. Thank you so much for taking the time to talk with us and through, yes, so much information in this episode now, and it's really valuable. And I love having it from that perspective where you kind of straddle both worlds. And I think that taught us so much about what we need to think about or what's important when going through this treatment and checking our breasts regularly as well.
Mm-hmm.
So thank you so much. And thank you to everyone for listening in today on this episode of Chaos to Calm.
Thanks for having me, Sarah.
So welcome. Wow, what a information-dense episode that was with Dr. Chandrika Gibson. I'm so appreciative for her coming and sharing her knowledge with us. And we've covered off, how it might feel being suddenly put into menopause from necessary surgery or medications, and why, HRT isn't the solution in those situations, and different things to consider there. And also we've talked about some foods that you can use, and the great soy question, is it or isn't it an option? So lots for you to digest there. And don't forget to check out the show notes if you want to find out more about Chandrika and all that we've talked about today at www.chaostocalmpodcast.com. And once again, thank you so much for sharing your time with me today. I hope you found this episode as invaluable as I have. Stay tuned for our next episode, where I will actually be talking with a nutritionist, Angelica, who is also going through breast cancer treatment at this time. So I will speak to you in our next episode. It's really common for women over 40 to experience the chaos of changing hormones, mood, metabolism, and energy. But I hope you know now that common doesn't have to equal normal for you or them. You can help others understand they aren't alone in feeling this way, and that perimenopause doesn't have to be horrific, by subscribing, leaving a review, and sharing this podcast with other women in their 40s and beyond. Thanks so much for listening and sharing your time with me today in this Chaos to Calm conversation.